Perhaps the invention of the iPad hasn't rocked your world, and you may think smartphones sound like a dumb idea. But when it comes to technology, the latest dental innovations can change your life. Dentist Steve Marsh is here to show us and tell us about the techniques and materials that are modern must-haves when you're deciding on a dentist. Thanks for joining us today,
My
Steve.
My pleasure, Armin.
So, you know, there are times when folks have to find a new dentist or get a dentist. Maybe they've moved or whatever, and now we're talking about the tools that we should look for it and ask whether a dentist has. Tell us about some of these cool things.
Well, first thing, I think a relationship is important, whether you're working with a dentist, an attorney, whatever you have. One of the things that's important in my own career is that I work with a lot of specialists, people who, oral surgeons, for example, the same way you may work with a tax attorney. So that relationship's important. When you do a lot of cosmetic dentistry, which is probably about half of my practice in relationship to the other work, which is just general dentistry, you need a relationship with a laboratory, and so that's very important. Mm-hmm. I will tell you that I work with a lot of younger dentists. It isn't just people moving, but I work with younger dentists who say, what are the things that you think are important that a dentist should have? So whether you're choosing a dentist or you're a dentist setting up a practice, you want to have these things. I think these are pretty essential.
Walk us through. What's this?
Well, I have 4 things I want to start with, show you. This is a digital x-ray.
Okay.
A digital x-ray, instead of putting that piece of cardboard that we used to put in, we put this instrument in.
Into your mouth.
Into your mouth, and we take a digital x-ray, and immediately it shows up on a computer. First of all, I can show the patient on the computer exactly what they have. Here's a patient looking at her own x-rays, so the patient learns and gets acclimated to what they have, and I'm able to explain that in a much better session. It's also 90% less radiation than conventional
x-rays. So we don't have
x-rays.
to worry?
Not at all. It's the way we should do it. My own family, my own mouth, once a year for x-rays.
I want you to tell us about the funny glasses.
Yeah, these are funny glasses. I'd let you hold them, Armin, but I saw what you did in the last segment. And these are very important to me.
You're afraid I'm going to break them?
Yeah, and this is really, I think, part and parcel the most important thing a dentist should have today. These are microscope glasses, and sometimes you can actually use a microscope as well. But this allows me as a dentist, or any dentist who wears them, to see in your mouth, and everything's expanded. It's like looking at a movie screen. So we're looking in your mouth. It makes sure that we do a much better job, much more careful job. So I think all dentists should be using some form of this. My own dad used something like this 30, 40 years ago.
I'm sure these are a lot more effective than those were.
Yeah, but he did a beautiful job.
Sure.
This is a Diagnodent. When a dentist goes in your mouth, in the old days we put that Explorer in to look for decay. Well, we can't always tell exactly from that pointer. The Diagnodent is a laser type instrument, and it measures the density of the tooth. So when there's a question about whether or not you actually have decay, we'll put this in the mouth. Let me bring it down so your viewers can see it. And I actually have a model on which I'm going to then show it. And it measures density. And so here it gives you a reaction.
And it makes that noise when there is decay in your mouth.
Yes.
It can find the decay.
It can find the decay. It also gives a numeric reading.
Wow.
So that when we're thinking, well, there's a divot, is it actually decay or not, this helps us do it.
All right, and you brought some pictures, and I want to make sure we have a chance to look at these before and after pictures and how they relate.
Well, thanks. This is a patient who came to me, and we were able to use almost all the tools we have. She was unhappy with her smile, very outgoing, had a very important position, but really didn't smile. She's a very warm person. We were able to use some of these new materials, some of these new porcelains that we've talked about in the past to give her this beautiful smile, literally remade her whole smile. And she's a wonderful person, and now is the smile to go with it.
That's great.
But we used almost all the instruments with her picture. Okay. We even used diagnostic things like these things to look at decay.
All right, very good. One last thing that I skipped here. This is
we call this caries dye.
A little paint or some dye?
Yeah, it's actually a dye. And so when we're working on a patient, we clean out an old filling. We actually put this dye on the tooth. We dip this brush in it. We put it on the tooth, and then we wash it off. And any dye that's remaining tells us that there's still decay. Now that should be used every time you're taking out an old filling or doing new decay detection and taking away, to make sure all the decay's out. Not unlike if you had cancer surgery, you want to make sure all the cancer's out. Well, dentists should also be using this on every case.
Great information, great tips to help us pick the right dentist. Thank
Thanks.
you very much, Steve. Appreciate it. These technological tools of the trade can help you determine if your dentist is delivering up-to-date treatment. To learn more, give Steve a call. His number's up next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, developments in helping the disabled.